difficult, but someone with a bad hip who comes in and gets it replaced, we typically have them up and walking that afternoon. And this just kind of shows separating away all the muscles and everything, you know, what goes into a total hip. And you can see we kind of cut off the diseased bone on the end and put in a new socket right there. And then we put a new stem down into the canal of the bone with a new ball on the end of it. And just sort of like the knee, these come in a very large variety of sizes and shapes and lengths so that we can look at a hip and know exactly what size we need. And actually we do x-rays in the office where we take, you know, some digital images of a hip and do some pretty specific measurements and computer modeling so that when we go into the OR, we have a pretty good idea of exactly what we'll be doing for a person's hip. And so who needs a hip replacement or a knee replacement for that matter? There are a lot of people there with arthritis, and most of them don't need a major surgery. The time that I think a person needs something like this is really a quality of life decision. If someone comes in and they have a hip, you know, their left hip looks as good as this one, and their right hip is obviously deformed and worn out, if it doesn't hurt them, I would not, you know, tell them to have surgery on it. But it's the folks who have, you know, pain that is constant and severe, that's interfering with their daily activities and really affecting their quality of life. And these decisions, for the most part, I think more than anything, are sort of a quality of life decision. When somebody has something like this, that the medications aren't working anymore, and maybe they've tried injections and they're not working, sort of the end of the line, we talk about a joint replacement. And this is obviously a bad hip that I know I replaced. And then, you know, a little bit about the recovery period. I know it's a big concern about everybody, and I think the biggest advancements we've had in hip and knee replacement in the past 10 years or so have really been the improvements in anesthesia and the improvements in therapy. And we're finding that we can do anesthesia that's more directed right to the hip or the knee, and do some aggressive therapy protocols to get people up and walking right away. And they're just much more likely to have a good result and much less likely to have any type of, you know, hospital type complication. We really want to get people up and moving right away so that you're not having a prolonged recovery period and not worried about pneumonia or urinary issues or other things. I think that as we've kind of rehabbed people a bit more aggressively, they actually have had less pain and have had less post-operative issues. So we have been, one of the nice changes has been the work that our therapists have done in really helping everyone who has something like this done get along pretty quickly. You know, everyone is a bit different, so everyone's treatment plan is going to be changed a little bit based on the person's specific needs and on their other medical issues, obviously. But usually people are in the hospital about 2 or 3 days. A handful of people will go home the day after their hip or knee replacement, but usually it's about 2 days. Most people go home, a small percentage will go to a rehab type center for a little bit. The recovery, when people say, how long does it take to get better? It's hard to put a specific answer on that. You start getting better right away, and you're still improving for months and months. But usually within the first 4 to 6 weeks, people have gotten to the point that they feel better than they did before surgery. It might take a couple months to get all their strength and balance up and get to the point that they're really comfortable doing all the things they want to do on their new hip or knee. But the biggest changes are, you know, within that first 4 to 6 weeks. And it can often take a full year until somebody has, you know, 100% of their recovery, until they feel like, you know, they can walk as far as they want to and not even have to think about their total hip. But it's a gradual process. And I just put in some x-rays at the end here, just some interesting stuff we do. This is a poor young man who had a debilitating type of rheumatoid arthritis, where you can see his hips are through his pelvis bone, almost, you know, going that way into the pelvis on both sides. So it was a bit more of a complicated thing to bring him back out and bone graft and put new hips in there. But that's sort of an extreme of one of the things we do. And this is someone who actually was in a car accident. She injured this hip and had a lot of pain there, and at first it didn't look like much, but over the year, it turned out that it was quite a significant injury, and her hip basically deteriorated until you can't really see where the ball stops and where the socket starts. So she's another person that went on to a hip replacement. And, you know, I'll just leave you with the thing that I try to tell all my patients, that these truly are quality of life type decisions. I always caution people to make sure they know that no one should ever tell them they need a hip replacement. You know, it's something available to you. You know, if your doctor tells you you absolutely need a new hip, you know, you need to know that that's really kind of your choice. I'm not doing heart surgery. I'm not saving lives. We're just treating hip and knee pain. It's something that if you have that kind of pain and it's affecting your quality of life, I think people need to know that they do have options with it. No one's no one's dying from hip arthritis, but it certainly is affecting the quality of life in a lot of people. And if something like that is slowing you down, certainly you do have options. And thankfully they're getting, as the technology improves, they're getting the replacements are getting sort of much safer and able to last a lot longer. And we're able to do it because of the anesthesia and the improved sort of perioperative protocols, that it's less of an event in a person's life maybe than it used to be. It's something you can get done and kind of get back to your normal things pretty quickly. So I think that's all I had. I don't know if that was 20 minutes or a bit more or less, but I think, you know, like I said before, the main thing is that if you came in with questions about your hips or knees or any other really orthopedic type issues, to grab me now or across the ground for a bit and ask me later, and be happy to talk to anyone. Yes, ma'am.
The plastic replacement versus the titanium with the metal.
Yeah.
What's the time element as far as how long it's going to last?
Yeah, that's a good question. So the question is, you know, basically how long are these going to last, and the different components, whether they're plastic or titanium or a different type of metal, how that affects it. Most of the components now are made of titanium. The actual bearing part, the part where there's one surface rubbing on another, the ball on the socket, is usually metal on a plastic liner. The titanium, although good to be the part that's attached to the bone, isn't good to be the sort of bearing surface. So they're made of a combination of these materials. So it's usually a titanium, you know, piece with a plastic sort of cap on the end. So you have a hard metal cobalt ball on the plastic liner. There are some other options. There are sort of ceramic options and some different ones. For most of them, we expect these to last, you know, 15 to 25 years. It's very difficult to put a number on it, because if they do wear out, it has more to do with, you know, how many cycles it's been through, how many steps a person's taken, and not how long. As you can imagine, if somebody is very inactive and they have their hip replaced, it's probably going to last forever. But if somebody walks 10 miles a day and does a lot of hiking, then it's more likely to wear out 15 years. But I tell most of my patients that my expectation is that their hip or knee replacement, my expectation is that it will be in and still doing very well 15 years down the road. And most people, as we kind of get into the 80s, the activity level, certainly the high impact type activity level, declines. And someone once told me, one of my professors I think said, you know, if someone gets to the age 80 with their hip or knee, it's usually just going to last forever. And that's sort of another thing to kind of consider, that the ones that wear out are the ones that are either have a problem, a rare infection or something like that, but it's usually someone that was placed in a young person who was really doing some aggressive things, like trying to do some aggressive hiking or jogging or something like that. Yes, ma'am. The question is there ever a point at which it's just too late and someone's hip or knee can't be helped? From a surgical standpoint, no matter how bad that arthritis gets, we can usually treat it. And even if it gets beyond sort of the standard arthritis pictures like the ones I showed,